One of the more common problems that we run into is that people call us up when they find out the kind of things that we do, the type of treatments, integrative medicine, and how it is we can help their cancer naturally. And we have a consultation on the telephone. We can discuss lots of things over the telephone. The nature of the diagnosis, the nature of how it happened, what do the lab tests show, and what kind of treatments we do. But something we can't do over the telephone is evaluate the person for specifics about our type of therapy. So we figured out a way that you can send a sample of yourself to us, and I could use that sample to test. I can test the medications we use, the chemotherapy drugs, the types of therapies, or the types of supplements, and come up with a recommendation for a treatment plan that we call a health profile that is specific to your needs. Here's how it works. You would contact us and obtain a test kit. We call this a cheek swab collection kit. We send to you in the mail, priority mail, an envelope like this. And when you open the envelope, inside will be a number of forms, which begins with a collection kit instructions page. And then there are several different sheets that have to be filled out and completed. This involves an informed consent, which gives us permission to do this for you, a history form, so we have some basic background, and a payment form. When you get the collection kit and you fill those out, here's how it works. You'll have a little bag like this with a little Q-tip swabs inside. So you take the Q-tips out, and be sure to put your name and the collection date on this little bag. And then there are 4 little swabs in here. You would take 2 of these and rub inside your cheek, between the teeth and the cheek, as if you were brushing your teeth with about that same pressure, and put those inside the bag. And then you take the other 2 and do exactly the same thing on the other side. You would swab each side for about 5 seconds each. This collects enough cells from the inside lining of your mouth to contain the DNA that my sensitive computer system can use to test. So everything goes back in the bag, and then you take these cheek swab sticks about halfway out and hold it firmly, and then break off the sticks like so and discard the unused part, and be sure the other sticks now with the samples are inside the bag, and you seal that up. Then you take the sealed bag that's got your name and the collection date on it, and all the papers that you filled out for us, and then fold these things up and they go into the envelope that comes back to us. Just put your name and the return address. Postage is already prepaid, and it'll arrive back at our place in 2 or 3 days. It takes me another 2 or 3 days to do the test, and then I will write a written report of what my findings are and what recommendations are to send back to you, either in the regular mail or via email. So by using this cheek swab collection kit test, it's a way that you can send a part of yourself to us so that we can do the testing here to help determine if the type of therapies we do will be useful in your kind of care.